Jamie, thank you. Let's talk about this health alert for you right now, because this is really interesting. A new study published in the Journal of Archives of Disease in Childhood reveals that children that are born by cesarean section are more likely to become obese than if they were born naturally. So here to talk about this now is Dr. Michelle Coffield. Thank you so much. OBGYN just in the Lake Mary area, so we appreciate you coming in.
Absolutely.
First off, what do you think about this study?
This was a really interesting study. This was a study done in Boston out of Harvard. They took 1,200 women and they followed them out for 3 years after they delivered their babies. They split them up into groups. Some women had C-sections, some women delivered naturally. And at age 3, they looked at these children and said, how many of these children are obese? Out of that population of obese children, they found that twice as many of those obese children have been born by C-section that have been born naturally. Now, with that being said, they're not sure why. They haven't been able to find the actual link between the two, so they're not ready to say it's a cause and effect, that the C-section is what caused the obesity, but it's definitely something for us to link into.
It's just a correlation right now.
Absolutely.
Okay, my question is, I think a lot of people are sitting down and watching this saying, how did they control the weight of the mothers? Because obviously there's a genetic impact here.
They actually used that as part of their, when they did the formulas, when they calculated how many babies were born by C-section and vaginal and how many were obese, they really took that into account, because you're absolutely right. When women are bigger, that does put you at a higher risk for having a bigger baby. And if the babies are born and they're bigger at birth, then they're more likely to be bigger at age 3, at age 5, at age 7, and even in adulthood. So they actually took all that into account when they did their studies, and when they even accounted for those facts, they still saw the trend.
Now, how many people in the United States get a C-section?
You'd be surprised. 1 in 3.
1 in 3?
1 in 3 babies in this country right now is born in C-section. Now, my hospital at Central Florida Regional, we're either at or below that rate right now, but there are many factors that lead into it. The C-section rate right now, you have to take into account, did she have a prior C-section? Was the baby malpositioned? Was she breech and the baby wasn't head down? So there are other factors that lead into why we're doing a C-section. And of course, if it's an emergency and the baby's life is at stake, we have no other choice. But the trend has actually gone up from about 20% of babies born by C-section in 1996 to 33% this year. And we as physicians are very concerned about that.
I mean, obviously, this is something that mothers cannot elect to do. Is that correct?
Actually, you're wrong. There's about 4 to 8, and in this country today, about 4 to 18% of babies can have their mothers elect to deliver them.
Really?
Yes, that they don't want to deliver naturally, that they want to have a C-section. Now, we as physicians typically discourage that because there's so many benefits to being born naturally. But,
like what?
Well, especially for respiratory purposes. When the baby goes through the birth canal, they get a squeeze as they go through the canal that helps to get rid of that fluid through the lungs. We know this is a fact, that it helps with breathing and respiration. It leads to less asthma later on in life. Okay. But we're not sure what is the benefit of going through the birth canal in helping the babies not be obese later on. We're not sure what that link is.
So do you say to yourself and to your patients, do you think that this study does have some validity?
I think that it's definitely something to talk to the patients about. If someone comes in and they're saying, I really don't want to deliver vaginally, I really want to have a C-section, we always counsel our patients about the risk of surgery in general. There's risk of infection, there's risk that an organ could get damaged, they could get scar tissue, they could be setting themselves up for a repeat C-section in the future. But this is something that's not only can you as a patient be at risk, but your baby could be at risk. So it's something else to really counsel the patients about.
Dr. Michelle Coffield, thank you so much.
You're very
welcome. Excellent information. Send it over.
Really was.